Welcome back to Breastfeeding Nurtured, all you need to know. In our previous session on breastfeeding low birth weight and ill babies, we discussed the vital role of breast milk in the care of these vulnerable infants, highlighting the importance of continued breastfeeding, maternal support, and cup feeding techniques. Today, in our session on expressing and storing breast milk, we will delve into the methods of expressing breast milk both manually and using a breast pump. Before we dive into the first slide, do not forget to subscribe to my channel by simply scanning the QR code. Stay informed with the latest breastfeeding best practices. Do not miss out. Join us today. Let us now explore into the essential skills for expressing and storing breast milk, enabling babies to continue receiving its invaluable benefits even when direct breastfeeding is not an option. Our learning objectives for this session are to identify situations where expressing breast milk is beneficial, to know the techniques required to stimulate the oxytocin reflex effectively, to select and prepare a suitable container for expressed breast milk, to guide the mothers through the steps of hand expressing breast milk, to understand the selection and proper use of an electric breast pump, to know the proper method for storing expressed breast milk. Before we dive into learning effective techniques for expressing breast milk, it's important to note that many mothers successfully express ample milk using their own methods. However, challenges often arise due to improper technique. Mothers also need the support of their families and friends. If a mother's current method works for her, she can continue using it. However, if she struggles to express enough milk, teaching her a more effective technique can make a significant difference. As you can view from the list, expressing breast milk serves as a variety of purposes from alleviating breast health issues to ensuring a steady milk supply and providing milk for babies in various situations. This underscores the importance of expressing breast milk as an essential skill for mothers. By learning this technique, mothers can confidently overcome challenges and continue breastfeeding successfully. It's equally important for caregivers to support and guide mothers in mastering this valuable technique. The oxytocin reflex is essential for milk flow, which is triggered by the baby's suckling or a mother's sensory bond with her baby. Learning how to activate this reflex is vital for successful milk expression, particularly when the baby is not nursing directly. Before learning the technique for expressing breast milk, let us first explore methods to stimulate the oxytocin reflex. Providing psychological support is essential to help the mother stimulate the oxytocin reflex, building her confidence and addressing any sources of pain or anxiety can create a positive environment for milk flow. Encouraging her to focus on loving and reassuring thoughts about her baby further enhances this process, fostering a strong emotional connection that supports the reflex. Let's now take a closer look at the practical techniques. The mother should choose a quiet, comfortable spot or seek support from a group to feel relaxed while expressing breast milk. The helper can ensure privacy and a peaceful environment. The mother should hold the baby close or focus on the baby's image to stimulate milk flow. The helper can encourage and support this bonding movement. The mother can use a warm compress or take a warm shower to enhance oxytocin reflex. The mother can use her fingers to gently roll or pull the nipples to trigger the letdown reflex. The mother should massage the breast in circular motion or lightly stroke towards the nipple. The helper can assist by demonstrating or supporting the process. The helper should be asked to give a gentle back massage, which we will be discussing in detail in the next slide. Let's now explore a simple yet effective technique to stimulate the oxytocin reflex through a back massage. Here's a step-by-step guide for the mother and the helper to follow. Position the mother so that she sits comfortably at a table, resting her hand on her crossed arms, aiming for a relaxed posture. Ensure comfort and calm atmosphere to make the mother feel at ease during the process. The mother should remove clothing from her upper body to allow her back and breast to be uncovered. Ensure the chair is positioned so that her breast can hang freely without any pressure. Massage technique involves using thumbs to gently stimulate both sides of the mother's spine, applying small circular motions starting from the neck and moving towards the shoulder blades. Massage needs to be repeated in a back and forth motion for 2 to 3 minutes. Breast milk can be expressed manually with hand or with electric pump. Hand expression is considered the most cost-effective method as it requires no appliances and can be done anywhere at any time. Hand expression is easier when the breasts are soft but becomes more challenging when they are engorged and tender. The technique should be learned by the mother within the first or second day after delivery rather than waiting until the third day when the breasts are full. Breast milk should be expressed by the mother herself as the breasts can be easily heard if someone else attempts it. Before we begin discussing the hand expression technique, it is important to go over some general precautions that should be taken during the demonstration and assistance process. These guidelines ensure that the technique is performed correctly and comfortably while maintaining respect for the mother's privacy and comfort. Demonstrate the technique on your own body while the woman follows. A model breast can be used. Guide the mother gently and with care to avoid inappropriate touch while correcting placement of her fingers. If needed, place your fingers on top of hers to demonstrate proper pressure. To prepare a container for express breast milk, the following steps should be followed. A cup, glass, jug or jar with a wide mouth should be chosen. The container should be washed with soap and water. This can be done the day before. Boiling water should be poured into the container and left for a few minutes to kill most germs. When ready to express milk, the boiling water should be poured out of the container. Now that we have learned the techniques for oxytocin stimulation and covered the precautions and preparations, let's move on to the step-by-step guide for hand expression of breast milk. The process should focus on gently guiding the mother with touch only when needed. Ensure cleanliness by hand washing with soap and water before expressing. The breast only needs washing once a day to avoid drying out the skin. Position should be comfortable, whether sitting or standing with container close to her breast. Position her thumb above the nipple and areola and the first or two fingers below opposite the thumb. Support the breast with other fingers. Gently press inward with the thumb and fingers towards the chest wall, avoiding too much pressure to prevent blocking ducts. Press behind the nipple and areola, focusing on larger ducts. Roll fingers gently, avoiding sliding or rubbing the skin. Nipple squeezing or pulling the nipple should be avoided as it can block milk flow. Remember that expression comes from the areola, not the nipple. Continuing further with hand expression of breast milk. Breast milk should be expressed from one breast for 3 to 5 minutes until the flow slows, then switch to the other side. This process should be repeated for both sides 5 to 6 times. It may take 20 to 30 minutes to express fully, especially in the early days. Do not rush. For colostrum collection in the early postpartum period, Use a 2 to 5 ml syringe to avoid wasting even small amounts as the milk starts to flow. Some mothers may find that pressing inward simultaneously with breast compression helps increase milk flow. Once a mother is familiar with the technique of expressing breast milk, the next important step is understanding how often to express. The frequency of expressing breast milk depends on the specific needs of both the baby and the mother. For establishing lactation in preterm or sick neonates, breast milk expression should start on the first day after delivery, ideally as soon as possible, as even a few drops of colostrum can stimulate milk production, much like early suckling by the baby. To maintain milk supply, mothers should express as much milk as possible as frequently as a baby would breastfeed, at least every 3 hours, including at night, since infrequent or irregular expression can lead to insufficient milk production. If the milk supply seems to decrease after a few weeks, frequent expression for a few days every 2 hours during the day and at least every 3 hours at night can help increase milk supply. When expressing milk for a baby while at work, mothers should express as much as possible before leaving and at least twice during work hours, ideally every 3 hours, to maintain supply and ensure breast health. To relieve symptoms such as engorgement or leaking, mothers should express only enough to ease the discomfort. For nipple care, expressing a small amount of milk to gently apply to the nipple and the areola after bathing helps keep the skin moisturized and healthy. By following these guidelines, mothers can effectively express milk and maintain a healthy supply to meet their baby's need. Let us now explore the topic of breast pumps. When breasts are engorged and painful, expressing milk by hand can sometimes be challenging. In such cases, using a breast pump can be helpful. Pumps are generally more effective when the breasts are full, but less efficient when the breasts are soft. Breast pumps come in various types, including rubber bulb pumps, hand-operated pumps, and electric pumps. While some pumps are highly effective, others may have limited utility. Rubber bulb pumps, often referred to as breast relievers, as you can see in the picture, are widely available. Let's discuss the technique to use a rubber bulb breast pump. The first step would be to squeeze the rubber bulb to expel all the air from it. The second step is to position the pump by placing the wide end of the tube over the nipple, ensuring it forms an airtight seal with the skin. The third step involves releasing the bulb to create suction, which gently draws the nipple and areola into the tube. The fourth step is to repeatedly compress and release the bulb several times until milk begins to flow, collecting in the swelling on the side of the tube. Finally, the fifth step is to carefully break the seal to remove the pump, empty the collected milk, and repeat the process as needed. Disadvantages of rubber bulb pumps include difficulty in proper cleaning, as milk may accumulate inside the rubber bulb, which is hard to remove, leading to contamination. These pumps are not very efficient, particularly when the breasts are soft, and they should not be used to collect milk for feeding the baby due to the risk of contamination. By understanding the correct use and limitations of breast pumps, mother can make informed choices to manage engorgement effectively and ensure safe practices. After having discussed the short-term use of rubber bulb pumps, which has its own limitation, let's have a look at other types of hand-operated pumps and electric pumps. These breast pumps, whether manual or electric, consist of three essential components, each serving a vital function in the milk expression process. Breast shield is a cone-shaped cup which fits snugly over the nipple and the surrounding areola, forming a secure seal to facilitate effective milk extraction. pump creates the vacuum needed to stimulate milk expression. Depending on the design, the pump may be directly connected to the breast shield or linked via plastic tubing, ensuring flexibility in its operation. Milk container is a detachable reservoir positioned below the breast shield to collect the expressed milk. This container is designed to safely store the milk until it can be transferred or used. Let's now see how manually operated breast pumps work. These pumps are particularly useful in situations where electricity is unavailable or when portability is essential, such as during travel. It is crucial to understand how to assemble and disassemble the pump correctly and to identify which parts require cleaning and sterilization after each use. Proper maintenance ensures both efficiency and hygiene, safeguarding the health of both mother and baby. Pumping mechanism is equipped with an ergonomic lever, valve and diaphragm for efficient operation. The pump generates gentle suction through a funnel-shaped breast shield facilitating milk expression into an attached collected vessel, typically a sterilized graduated bottle of at least 150 ml. Other components of the collection bottle include a cap, screw, ring, and sealing disc for secure milk storage. The pump allows complete disassembly for thorough cleaning. It can withstand a minimum of 5 minutes in boiling water for sterilization. Body components including bottle, pump, cap, and stand are made from safe materials such as propylene, polyethylene, or thermoplastic elastomers, whereas the membrane and seals are made from high-quality silicone for durability and hygiene. Kindly note that adhering to the manufacturer's care instructions ensures optimal performance and maintains proper hygiene. Electric breast pumps have become valuable tools for lactating mothers, offering a convenient and efficient way to express breast milk. They are particularly helpful for working mothers and for those with breastfeeding challenges or in situations requiring milk storage. They are often preferred by mothers who find them more efficient than manual pumps or hand expression as they can extract a larger volume of milk. However, some mothers still find hand expression equally effective and more convenient. While pumps may differ in features like suction pressure, frequency adjustments, and additional options like double cycling, this session focuses on providing general guidance about electric breast pump. Proper guidance is essential for mothers to use electric pumps correctly, including instructions on assembling, disassembling, and identifying parts that require cleaning and sterilization after each use. Hygiene is particularly critical since electric pumps can transmit infections, posing risk when shared between users. Regardless of the pump preference, all mothers should be encouraged to learn hand expression as a backup in case of machine malfunction, or power outages. Before exploring electric breast pumps further, it is essential to first understand the importance of selecting the right breast shield or flange size. A properly fitting breast shield not only enhances comfort but also improves efficiency, enabling mothers to express more milk effectively. Breast shields come in various sizes, and the selection should be based on nipple diameter rather than the breast size. For assessing breast shield fit, begin with the breast shield provided with the pump or based on measurements. Ensure that the nipple is centered and the shield is gently pressed against the breast. The nipple should move freely in the tunnel without rubbing against the sides. Shield size should be changed if the nipples rub against the tunnel causing discomfort, or if excessive areola is pulled into the tunnel, or if there is redness or whitening of the nipple or areola, and if the mother feels milk remains unexpressed after pumping. It is to be noted that breast shield size may vary for each breast and may need adjustment over time due to changes in breast tissue, skin elasticity, or nipple size. Ensuring a proper fit helps prevent blocked milk ducts and maintains optimal milk flow. Let's learn how to measure nipple size for selecting the right breast shield. Breast shields come in various sizes and selecting the correct size is essential for comfort and efficient milk expression. The choice should be based on the nipple diameter, not breast size. Measure the nipples width excluding the areola as shown in the slide and choose a shield with slightly larger tunnel diameter to ensure that the nipple moves freely without rubbing against the slides. Let's now discuss key guidelines for using electric breast pumps effectively. Always switch off the pump first before removing the funnel from the breast. Double pumping or expressing milk from both breasts simultaneously saves 10 to 15 minutes and boosts the prolactin reflex, leading to a higher milk yield in less time. Pause for 30 to 60 seconds when the milk flow slows down. Pumping duration can vary between 20 to 40 minutes or when milk flow ceases. Avoid discomfort or pain by ensuring proper pump uses and selecting correct flange size. For colostrum collection soon after delivery, manual expression is recommended. For pump hygiene, use electric pumps with isolated motors to prevent contamination. Each mother should have a personal set of tubing. Expression frequency should be for at least 8 sessions or a total of 100 minutes per day until the baby starts breastfeeding. Mothers need to fully empty both breasts during each session to maintain milk production. Maintaining proper hygiene and sterilization is crucial for the safe and effective use of electric breast pumps. Let's explore key steps to keep the equipment clean and safe for both mother and baby. Disassemble the pump and separate all parts of the pump including small components. Wash all parts thoroughly using a mild detergent to remove any milk residue. Rinse all parts thoroughly with warm water to ensure no detergent remains. Sterilize the clean parts as recommended in the manufacturer's guidelines such as boiling or using a sterilizer. Properly store sterilized part in a clean, dry place to avoid contamination. Regularly inspect the pump for wear and tear and replace any parts as needed to maintain its efficiency. It is to be noted that specific sterilization instructions may vary, so always refer to the pump manual for detailed guidance. After expressing breast milk, proper storage is essential to maintain its safety and nutritional value. Here are guidelines for storing freshly expressed breast milk under various conditions. Choose appropriate storage container. Use clean plastic or glass containers with tight fitting lids. If a refrigerator is available, store milk in it. For long-term storage, keep at least 10 containers ready. Milk should be stored immediately after collection. Pour the expressed milk into a container, cover it tightly and place it in the coolest possible location. Store only the amount needed for one feeding in each container to minimize waste. For storage, if a refrigerator is unavailable, expressed breast milk can be stored at room temperature for up to 6 hours, even in warm climates. In the main compartment of the refrigerator, where the temperature is plus 4 degrees centigrade, expressed breast milk can be safely stored for up to 24 hours. For long storage, use the freezer compartment where it can remain usable for up to 3 months at minus 20 degree centigrade. For thawing frozen milk, you can move it to the refrigerator's main compartment or leave it at room temperature. Avoid rapid heating. Instead, warm the milk gently by placing the container in a pot of water at hand temperature. I am repeating, do not boil the milk and once thawed, use the milk within 2 hours. If the milk is not consumed, give it to an older child or discard it. These practices ensure the safety and nutritional integrity of expressed breast milk for feeding. We will discuss the storage of donor human milk in human milk banks in an upcoming session as part of our journey into understanding human milk banking. That concludes session 9 on expressing and storing breast milk, where we learned right techniques for expressing and storing breast milk. In the upcoming session 4B, titled Breastfeeding, the first hour after birth, you will discover effective techniques for initiating breastfeeding within the first hour after both vaginal and cesarean births. While positioning during breastfeeding was covered in session 4, which will now be marked as session 4A. Session 4B will be specially added in response to audience feedback to provide a more detailed guide on supporting mothers during this crucial time. We encourage you to continue sharing your thoughts, questions, and suggestions for future topics to help us better support your learning journey. Feel free to reach out via email at rajinder_gulati at hotmail.com. Your feedback is invaluable as we strive to create informative, helpful content. Thank you for joining us, and we look forward to continuing this journey together. Have a wonderful day.